So good afternoon again, judges. My name is Julia, and together with Hadley, Amanda, and Caroline, we are going to be presenting Breathe, a call to action to improve air quality. Before we get started, would everybody in the audience just take a big deep breath with me? Over the course of this presentation, we're going to demonstrate why you shouldn't take that for granted. The World Health Organization defines air pollution as any chemical, physical, or biological impact to the natural environment that negatively impacts it. And all of these are options of things that can cause air pollution, from things like combustion car engines or factory manufacturing. And so why should we care? We can't see air pollution. It's not like an oil spill where you can see that there are ducts covered in oil. You can't see a 2.5 micron particle going into your lungs and causing injury, but we should care because air pollution has been demonstrated to cause negative health impacts such as an increased risk of cardiovascular disease, increase in lung diseases such as asthma and bronchitis, and as you can see from the numbers up here, asthma can really negatively impact our children. So in 2020, there were 270,330 asthma-related ED visits among children. And then if we go to 2021, out of all of those ED visits, 145 of the children died. Back from 2013, we see that there was a total cost of about $82 billion associated with asthma, and that number was projected to double in the coming years after that because of the increased risk of pollution due to climate change. And now we get to our inspiration, which is KM. She is a sixth grader here in St. Paul, Minnesota, and as you can see, she loves soccer. She also has asthma, and last year she faced a really scary asthma exacerbation that wasn't helped at all by her albuterol inhaler. She actually had to be EpiPenned and taken to the emergency department at Regions Hospital, where she was then admitted. Our goal with this plan is to help prevent any of these issues that happen to KM from happening to any other students in St. Paul.
So I will now introduce our initiative, Breathe, Building Resilient Environments in Teachable Health Education. So with Breathe, our mission really is to improve air quality by empowering communities with the knowledge and the tools to create a cleaner and safer environment that's accessible to all. So our Breathe program consists of 3 initiatives. The first is our interprofessional educational series that will be led by our graduate students. And then we have our Green Garden series. And lastly, we will be providing education and materials to create Corsi Rosenthal boxes, which are DIY air purification systems. So moving on to our target population, here pictured is the St. Paul Public School District. And we chose this district, and we also chose middle schools, grades 6 through 8 specifically, because KM was a 6th grader that was attending one of these schools. And you can see the 4 schools highlighted in green are the middle schools that we selected. And we selected these schools because they have the highest number of students of these middle schools that are on free or reduced priced lunch. And research has shown that children growing up in lower income households do have an increased rate of poor asthma-related health outcomes. So our Breathe program consists of 4 phases. Phase 1 takes place from May 2025 through December 2025, and this consists of the assembly of our task force and also our baseline data collection. Phase 2 then takes place from January of 2026 through December 2026, and this will consist of our pilot program in those 4 middle schools and also concurrent data collection throughout the year. And then Phase 3 will take place from January of 2027 through December of 2027, and this will consist of our data analysis and modification of our Breathe program based off that analysis. And then lastly, Phase 4 will take place from January of 2028 through May of 2028, and this will consist of the program expansion of Breathe into 4 additional middle schools, and also the assessment of our SMART goal. So now moving on into Phase 1, this will take place from May 2025 through December 2025. So first, we're going to assemble our task force. Our task force will be made up of our interprofessional graduate educators, city council members that oversee wards 2, 5, 6, and 7, a state house representative, school staff, PTA members, and parent volunteers, and also our 3M partners. So to collect our data, we aim to gather data of asthma-related ED visits among middle schoolers that are attending these designated schools. And that data is going to be broken down by race and socioeconomic status. And we're going to collect this data from Regions and Children's Minnesota St. Paul campus hospitals. And we're going to gather data from the previous 6 months and also the 6 months encompassed in this phase 1 so that we can have a full year's worth of data before we move on into phase 2.
So now I'll chat a little bit about phase 2, which will take place from January of 2026 to December. And like Hadley said, this is our pilot program, which will touch on those 3 initiatives. So the interprofessional education sessions, our Green Garden initiative, and our Corsi Rosenthal boxes, and it will take place at those 4 middle schools. So our first initiative is the Interprofessional Student-Led Initiative, where we will invite graduate students from the University of Minnesota to help teach our students. These graduate students will be from the fields of medicine, nursing, athletic training, public health, social work, and pharmacy. They'll teach on topics such as asthma emergency preparedness and response, as well as air pollution prevention and education. So what will this look like? We plan to invite our graduate students to come 1 day per month, and they'll teach the students during the day and incorporate those lessons into their science education courses. As you see on the far side, we have KM being taught by one of these graduate students. We also want to incorporate the families and parents of these students as well, so we're hoping to hold an after-school session with the parents and families. And on this side, you can see KM's mom attending one of these sessions. Something that's really important to us is that these sessions are accessible to everybody. And we know that in St. Paul, there's a large population who don't speak English as their first language. So we want to make sure that these sessions are held in multiple different languages. And we also want to make sure that they're provided in multiple different formats. So for those who cannot attend in person, we want to have a Zoom format. And we also want to make sure that we provide handout flyers for those who can't attend at all. And so you'll see in our middle slide, we have Cam's grandmother who's attending virtually through Zoom. Our second initiative is those Corsi Rosenthal boxes, or as Hadley referred to as our DIY air purifiers. Now these boxes are made up of 4 air filters, 1 box fan, and some duct tape. So we really like this project because we can provide air purifiers to the students and their families with cheap materials, so there's no financial barriers. As we know, KM's mom works at 3M, so we're hoping to utilize this 3M relationship to get maybe a discount on some of these materials. We also know that 3M has a Visiting Wizards program where they send out STEM volunteers to the community and they can teach children science demo projects. And we thought that these Corsi Rosenthal boxes would be a great opportunity for the 3M Visiting Wizards to come and teach our students and allow them to take these materials home with them. We got this idea from Brown University, who did a study a few years ago, and they did show that there was efficacy to these air purifiers, and they were shown to decrease indoor air pollutants. And then finally, our last initiative is our Green Garden program. As I'm sure we all know, having a green infrastructure is super important to not only our physical well-being, but also our mental health. And we think our green gardens not only improve the green infrastructure at our schools, but they also help to actively decrease air pollution by carbon sequestration. So what this will look like is we are planning to hold a field day called like a May kickoff day in May of each year, where the students, along with the PTA, family volunteers, and school staff will start these school gardens for the year. And then among following months, they'll continue with the upkeep during recess or during after-school activities. So when we were looking into how and where these green gardens will take place, we found that a lot of the St. Paul public schools already are affiliated with community gardens, or some of them already have their own school gardens as well. So as you can see, the highlighted 4 schools that will be a part of our pilot, 2 out of the 4 already have their own school garden. So at these schools, we want to improve upon the gardens and make them better. 2 of the other schools do not have their own school garden currently, so as part of the Green Garden program, that's when we would implement new gardens at those schools.
And then moving on to phase 3, so this will happen during January 2027 to December of 2027. It's going to be a continuation of our pilot program that was presented in phase 2. During this year, we're going to be making adjustments, finding through our data what needs to be improved, and making those adjustments that way we're on par towards our SMART goal. In terms of analyzing an adjustment, we have 3 questions that we're going to be looking at. 1, how does our data collected during phase 2 compare to our baseline data as stated in phase 1? 2, how does our data differ based on race and income status? And 3, what adjustments can be made to ensure that we reach our overall goal? Phase 4 is going to be happening during that January 2028 to May of 2028, and this is our program expansion portion of our initiative. During this expansion, we're going to be adding an additional 4 schools within that St. Paul public system. You can see those listed above in the pink boxes. We chose these based off they are the next level of highest rates in terms of the reduced or free lunches. So we want to make sure that we're getting those next step systems in order to implement it beyond that once we get to those phases. And then here we can see again with those 4 pink boxes above that 2 of our schools already have a Green Garden initiative somewhat started. So what we want to do there is obviously improve and make it as most successful as possible with our initiative. And then 2 of our schools do not have one currently. So we want to make sure that we're implementing there, adding the plants, getting the gardens started, and having our community outreach within those areas. And then this is our SMART goal as follows. With Breathe, we aim to decrease the number of asthma-related emergency room visits in all children attending the specified public middle schools, regardless of the race and ethnic status, in St. Paul, Minnesota by 10% between that January 2026 and May of 2028. Well, looking at the expense breakdown, we have these numbers based off of roughly $3,000 from the first 8 schools that we're working with. So that's where we're going to have all these spaces coming from. In terms of our interprofessional education, this is developing those handouts, working with designers and staff to make sure that we have the most efficient way of getting the message and education out, as well as the actual supplies for said education to put out into the community, roughly at $30,000. The Corsi Rosenthal boxes, with our 3M partnership, we're hoping here with about a 25% discount. Obviously, we would love a 100% discount. That would be awesome. But realistically speaking, we have $180,000 allocated towards the air filters. And then with our box fans and duct tape, that's based off the current Minnesota retail rates. And that's found at the $75,000 and $10,400 aspects. And then Green Garden, this is for all of our plants, the tools necessary, the time that's going to be given to put into building these gardens and making sure that everything is staffed and ready to go. And this is roughly $160,000. And in terms of additional expenses, we want to have that liability insurance. So Minnesota, we get cold here, okay? It's very snowy in our wintry months. And so we want to make sure, say something happens and a storm comes through and maybe damages part of the garden, we want to make sure that we have that insurance in order to replant where needed or start up those programs again for you. And this roughly comes out to about $500,000. We rounded up quite a bit. That way we have those extra funds if necessary. In terms of potential funding sources, we took from the state and federal breakdowns that we have. The U.S. Department of Housing and Urban Development has a $40 million allocation for initiatives that go towards school and adolescents with disease-oriented specifics, especially asthma. So within that $40 million allocation, they have about $2 million provided towards organization that applies. We also have the American Lung Association that has an asthma-friendly initiative for public policy in order to give about $50,000 for a 2-year cycle. And then with our Environmental Protection Agency, they have an allocation of about $5 to $8 million for each of those organizations as well. And then with our 3M partnership, again, hopefully those donated filters, but if not, having that partnership to get the discounted rates for this initiative.
All of this to say that we also need to remember the why. So we are trying to implement all of these different initiatives to really help the students in St. Paul have better outcomes as it relates to their asthma. If you're taken out of school because you're in the emergency department because of an asthma exacerbation, you're not worried about studying for that test on Thursday. So if we can help improve the asthma outcomes for our students, we can also help things like their test scores or their attendance, and that's important. And we need to act now to safeguard the future of the students in St. Paul, but more importantly, the students that are there now. Would everybody take another deep breath with me? Let's get started. Thank you. Any questions?